Hi, this is my second video explaining the role of medication in treatment of depression and anxiety. In the first video, I explained how medication helps the person who suffers from depression and anxiety, that what we're out to achieve with that, lowering the water in the pool analogy. In this video, I'm going to explain why it's so important to take this medication exactly as prescribed. By way of example, think of having a headache and think of taking a Tylenol or an Advil. When you take that medication for a headache, within 20 minutes, it reaches what we call therapeutic level. It lasts in the brain a good 3-4 hours, and then it comes down. Hopefully your headache doesn't come back. But what's interesting about that is it's relatively quick action, that 20 minutes. People expect their antidepressant or anti-anxiety medication to work the same way, but it doesn't. Antidepressant, anti-anxiety medication actually takes weeks and weeks to build up to that therapeutic level in the brain. There's something in the brain called the blood-brain barrier. That is a mechanism of the brain to help keep the blood as pure as possible. For whatever reason, things like Tylenol, Advil, it gets through the blood-brain barrier really easily. Antidepressant, anti-anxiety medication, not so much. So that's why you have to take it for so long before it reaches that therapeutic level. In fact, we don't know if this medication is truly being helpful until about 6 weeks, plus or minus 2. Here's the rub though. As you take this medication, as you begin this medication, many people are expecting that quick result. And when they don't get it, they may at the same time experience some side effects. The most typical of those side effects will be headache, dry mouth, nausea, dizziness. So here are people, they're taking the medication, they're not experiencing a benefit, but they have these side effects. What do? They immediately discontinue the medication. They say, this only hurt, wasn't helpful. What they don't know is that typically by the second week, the body is adjusted to the medication, so the side effects go away. And then as the side effects go away, slowly we're waiting for the medication to reach therapeutic level. That's why it's so important to take this medication as prescribed. Now, you may be prescribed this medication for a half a year, or an undetermined amount of time. There may come a point in time where you say to yourself, I want to see if I still need this medication. So you can do that, but if you do that, this is the kind of medication that you actually want to come off slowly. If you come off quickly, it's as if the brain says, hey, where'd that medication go? And the brain gets upset with that, and it shows in poorer behavior, more anxiety, more depression, relative to the withdrawal from the medication. So if you want to come off the medication, we call that taking a drug holiday to see if we need that. What you want to do is speak to your physician. And what your physician will do is will taper the medication over the course of 1 or 2 or so months, depending on your needs and your unique situation, till we finally get the medication down, and then see how are you doing as it's being reduced, and then maybe finally withdrawn. So whenever you're taking antidepressant medication, anti-anxiety medication, please take it as prescribed. Don't expect an immediate result. It kind of shows up slowly over the course of typically 4 to 6 weeks.